So, one of the newer concepts patients are hearing a lot about now is something called the Preservé technique of breast augmentation. So, what actually is it? At its core, the idea behind Preservé is pretty simple. Can we place breast implants while minimizing unnecessary tissue disruption and provide for a rapid recovery? Traditionally, breast augmentation often involves kind of a more extensive dissection to create the implant pocket. But with Preservé, the philosophy is a little bit different. The goal is to create an implant space in a more controlled and tissue preserving way using some specialized instruments and careful dilation techniques rather than just wide surgical dissection. In many patients, that may mean less tissue trauma, less bleeding, and potentially less post op discomfort, and in some cases, a quicker early recovery. Now, I always want to be careful not to oversell things online. This does not mean it's pain free, it's zero downtime, or that every single patient recovers instantly. Surgery is still surgery. But I do think one reason surgeons are excited about this approach is that modern breast augmentation has increasingly moved towards smaller incisions, more precise pockets, preserving anatomy, and creating a more natural result with less disruption. Another important point is that Preservé is not necessarily ideal for everyone. If someone's got a lot of asymmetry, their tissues are very tight, they need complex pocket adjustment, or you're combining it with a breast lift, then a traditional approach makes the most sense. So it's not about saying old way bad, new way good. It's really about adding another tool in the breast augmentation toolkit. And honestly, that's where plastic surgery is heading in general. More personalization, more precision, and less just one size fits all. At the end of the day, the most important factor is still thoughtful surgical planning and careful technique, not just the name of an implant or a buzzword procedure. So, if this was helpful, let us know, and we'll keep trying to create great content. And if you want to talk with us, go ahead, give us a call and schedule a consultation, and we'll be happy to help you out. Have a good one.